For small pupil cases, would you prefer the iris hooks, Malyuga rings, or placing ZEPTO under the iris?
I think it's a really good question. I think that I think a lot of it will depend on surgeon comfort. I think for a really tiny capsule, tiny pupil, like a 2 millimeter pupil, I think we're going to have to do something to expand the pupil. I think probably I would start with iris hooks first, just because I think there's less bulk size in the eye. Although I think many surgeons have used a Malyuga ring as well. I think you could use either one, but I probably would start with that. But for maybe a 3 or 4, maybe a 4 millimeter pupil, I think this can easily be placed under the pupil edge. And ensuring us free of anything, putting some downward pressure, and then getting a good capsulotomy. But I think it's really up to a surgeon's comfort level. I would certainly say for starting off, the best thing would be to use a pupil expander. I think if it's a really shallow chamber or a small eye, I think iris hooks are good, as I said, less bulk in the eye. For an average to bigger eye, I think a Malyuga ring works quite well, and this certainly can fit within that apparatus.